Hi from Czech Republic, from High Intensity Interval Training Lab. My name is Jan Hibelbauer, and I will guide you through this short video where I want to show you how we work with athletes to gather appropriate information for scientifically and physiologically based and guided high intensity interval training. In this video, we will be using Road Echo Bike, metabolic analyzer from Cortex Medical called MetaMax 3B, and near-infrared spectroscopy device called MOXY Monitor. I have already introduced myself. I'm Dr. Jan Hibelbauer. I'm sport physiologist, andrologist, and urologist. My colleague and co-founder of High Intensity Interval Training Lab is Dr. Petr Schlegel, PhD, University Associate Professor, CrossFit athlete and coach, and proprietor of CrossFit gym called CrossFit Steel Wings. In this case study, I was a test subject, and this is the first slide with some assessment data. This slide contains values gathered by metabolic analysis. These are the max values that came out from the 515 test with a 30-second all-out at the end. VO2 peak at 40 milliliters per kilogram per minute shows that I am not at the best of physique compared to a typical endurance athlete, which I am not with my history of bodybuilding and powerlifting. My maximum heart rate reached 1.181 beats per minute. My maximum respiratory equivalent ratio reached pretty high levels of 1.44, about 170 seconds after the 30-second all-out test. And my minimal, which is kind of tricky value, was at 0.85, 20 seconds in the 30-second all-out test. As you can see, the muscle beast needs the oxygen, and I'm pretty much breathing athlete. So my minute ventilation, my peak minute ventilation was at about 220 liters per minute in 4.5 liters per breath at about 80 breaths per minute. The max calories burned or spent in the 30-second all-out test were 33 calories. Perhaps you wonder why on the previous slide I said the pretty low value in the RER was a tricky value. Well, doesn't it seem suspicious that during the all-out test, actually 20 seconds in the all-out exertion, my respiratory equivalent ratio is at its lowest? Well, it kind of is suspicious. And why is that? I will let you think for a while. Okay, do you have the answer? Yes? No? So verify if you were correct. The problem is that the action is taken here in the muscle, and the oxygen and the CO2 is measured here on the face mask. So it takes the 20 seconds from the place of action for the CO2 to get through the bloodstream and the lungs to the measuring device, which makes this metabolic measuring system pretty much useless for guiding through the high intensity interval training. So this is a place where I want to point out that the MOXY Monitor, which measures at the place of the action and delivers the results with a maximum delay of 2 seconds, is ultimate device for using in high intensity interval training. On this slide, you can see assessment data gathered through the MOXY device. During the 515 test, I reached the minimal values SSMO2 of 78%, which is not really low and is consistent with my state of physique and my training history. This value can be approximated to the VO2 peak. As you can see, the difference between SMO minimum and maximum is really low, which shows where the problem is. The 30-second all-out test didn't lead to much of desaturation. I actually got even worse desaturation during the all-out test. Knowing the fake equation, we can conclude that my VO2 limitation is at the point of extraction or muscle usage. So I can conclude my problem is work with O2. My body doesn't know how to properly work with O2, how to extract it from the blood, and how to use it in the muscle. On this slide, I will explain acquired values and show you the process of trying to model the appropriate physiologically and scientifically based training method. So my metabolic target is from the previous slide pretty much obvious. I want to increase O2 extraction and utilization. This can be done by promoting mitochondrial biogenesis and vascularization, which can be done by spending as much time as possible at as low as possible O2 in the muscle. How can you lower the SMO2? Well, the method is pretty obvious. Limit the O2 supply, which can be done at approximately 80% of my maximal work rate. I also want to minimize glycolytic capacity usage because of my history of being pretty much a glycolytic athlete. So on the other side, I want to spend as little time as possible above my critical power or work rate, if you want. I also want to maximize my recovery of glycolytic capacity without any or with as little as possible decrease in cardiac output, not to be stressing the cardiac system, which can be done pretty much at work rate ratio of 10 seconds work to 60 seconds of rest. On this slide, I present you with diagnostic 515 test with an all-out sprint at the end. This upper graph is from my quad, specifically vastus lateralis. The lower graph is from my forearm. These green boxes are estimated just orientational units of time spent working, and this is the rest interval. As you can see, I managed to go through 1, 2, 3 steps of the 515 test, and I pretty much don't have to describe, but I will do it anyway. The red color states for heart rate, green color for SMO, brownish color for total hemoglobin. As you can see, first step was chosen to not to kind of have an impact on hemostasis. You can see at the beginning of the first step, SMO2 has risen, total hemoglobin has risen also a little bit. No exertion pretty much experienced here. The second bout was more interesting. There is a lack of signals, so let's focus on this second interval of the second step, which shows kind of lowering SMO2, which is done by kind of breaking the homeostasis, keeping the homeostasis thanks to compensatory mechanism like is buffering of protons, extensive drive for breathing, and also cardiac output. Here you can see the third step was really short for me because the intensity was chosen pretty much high. So you can see kind of breakdown of homeostasis about, let's see, about 2 minutes into the 5-minute interval. So I stopped and I did another about 2.5-2-minute interval. After about 5 minutes, I started it with the all-out test. The outcome of this test is pretty much obvious. You can see really bad desaturation. There is no pretty much sign of any ventilatory limitation. So there is definitely the diagnosis, as I stated before, the problem with extraction and O2 utilization. I just want to point out this part on the forearm, which may be described either as a blood flow redistribution, but I think it's more due to the fatigue of the lower limbs. I was pedaling at high intensity with my arm, so that's why there was a drop in SMO2 on my forearm. In this slide, I enlarged the all-out 30-second part of the whole test just to show you some details you can see on the NIRS device or the software that comes with the MOXY Monitor. First, I just want to conclude, and you can see pretty clearly from this graph, that heart rate is not a reliable source for guiding and prescribing high intensity training, as it keeps rising even after the interval has ended. What I want to show you is what you can see with the monitor during the short period of the maximal exertion. First, sometimes you can see at the beginning the muscle compression changing the blood flow, which is not seen here. but you can see pretty clear venous flow restriction caused by the increasing filling of the vasculature of the muscle and causing the blood not to be able to outflow, which kind of shows on this total hemoglobin curve, which kind of rises and shows there is more inflow than outflow. And as you can see, even during the maximum out exertion, the O2 is stable, which is explained only by one way, and that arterial blood is bringing more oxygen, which keeps the curve stable for a couple seconds. As the exertion rises and fatigue increases, there is another phenomenon which is called arterial flow restriction, and here you can see also venous outflow, which is caused by increasing filling of the venous and arterial parts of the muscle. There is also some edema rising, interstitial edema, causing kind of filling and compression of the muscle, causing the compression of the arterioles and veins, disabling the inflow of the oxygenated blood, which can be proven by small but then steep decrease in O2, which is being used but not being supplied. And also here you can see steepening decrease in the total hemoglobin, showing that there is more blood outflow than inflow, which probably may be explained by the recruitment of more and more motoric units, which are less adapted and cause more muscle compression. On this slide, I present you with data from my first training unit. Upper graph is from my quad, and lower graph is from my hamstring, just to have comparison of a really huge muscle mass and some smaller muscle mass. The training session was executed at the work rest ratio 10 to 60 seconds. After some warm-up, I started with a one sprint interval at about 60% of my maximum work rate. As you can see, not much happened on my quad, not much, little happened on my hamstring. After 1 minute rest, I started the sprints at the suggested rate, which was about 80% of my maximal work rate. As you can see, after the first, from the first till the seventh interval, the SMO2 was decreasing as expected and suggested. And as you can see, after the last interval, I tried to sprint at some lower intensity as long as I could to reach the SMO at its minimal values for as long as I was able to. Why did I end the test? Well, because as you can see from this moment, there started to be onset of ventilatory limitation, which was kind of driving me really high in my ventilation parameters and forced me to quit at this point. You can see from comparison from the upper graph, from the muscle with a larger muscle mass to the muscle hamstring with a smaller muscle mass, as the smaller muscle mass, how it's reacting pretty predictably and almost textbook-like. A small decrease during the interval, keeping decreasing after the interval, and getting back in the second half of the rest interval just to keep steadily decreasing. I hope in a couple months, or hopefully no longer than a year, I hope to see this undulation on this upper muscle. So that is everything from my presentation. I hope you learned something. I hope you understood everything. If you have any questions or suggestions, please contact us on our Facebook page, and take care. Perform by science and work on getting better. Bye.